Thank you all for coming. My name is Chris Gelcher, and I am a nurse practitioner here at Children's National Health System. And I want to give you a little background about our project here. So Children's National Health System and Georgetown University Hospital are both federally funded hemostasis and thrombosis centers. And in conjunction with the Hemophilia Association of the Capital Area, we applied for a grant from the National Hemophilia Foundation to build capacity. And our proposal was to design programs around the subject matter of transition.
Good morning. I have to do this Oprah thing because they're taping me. So there we go, right? So we're really glad you're here. Thanks so much for coming. This is really, you all should get a little star knowing the weather that's on the way here. It's it's a lot to come out. So we really appreciate you coming here today. And we're really going to talk a little bit about transition in general, but I'm going to be asking a lot of you to help us think about this. I think that's really the issue of how is it going to work for you, because it is individual, but I'll be talking about what's going on nationally as well as some of the resources that are available to you. So we'll first start with your experience here. And I want parents in the audience or young adults that have gone through this to really think about what you remember about your young years and healthcare. I know you all have great visions of what happened when you were younger, but we're talking about you in healthcare at the moment. And when did you leave your pediatrician? First of all, are any of the adults still seeing their pediatrician? Okay, so you all left your pediatrician and moved to an adult. Then the next question is, do you see an adult provider? Okay, some people are nodding their heads. All right. And was it continuous or was there a gap, right? And did you actively leave, i.e. made a plan? You took your records from your pediatrician and you went on to an adult provider, or really, no, it just sort of happened, you sort of disappeared in the system. The natural history here, when we looked at the data, is that men tend to drop out and they join the healthcare delivery system when they're around 50. They just don't see the need and just don't get connected. So I have to congratulate you for connecting in your 20s. Women tend to not get a general doctor at all. They tend to just go to any kind of clinic to get any kind of birth control or those kinds of things, or connect up with an OBGYN. So they don't really take care of their health and wellness way till they're much later. All right. So I think that's the problem here, is that we don't really have a good model, right? It's not like everybody has worked this out. And so you're starting a new path that we're really hoping nationally you'll be the leaders in making this something that everybody gets connected to early on. So let's sort of think about it that way. All right, so now let's look at the handout that you have. So you can see the questions here. We're going to be, talking about some questions, but when you're thinking about a new situation, let's make a game analogy, right? So you've got parents and adults in the room that know how to play the game, right? And you have to really think of all the things that you do to make it possible for your young person to interface with a very complicated system, which is the healthcare delivery system, and down to the littlest detail. Because you don't want to put them in the middle of the game without the rules or without what they need to do. And they can't learn it overnight, right? After all, we didn't, right? You heard it. Some people sort of bounced around in the system. So I want really think about what it is that you need to know. So let's sort of first start. So when is the age of majority? When does the legal system make you believe you're an adult? You know? 18. Okay. Does everybody agree with that? Not so. Some parents don't agree with that, but the system believes that. All right. Let's be clear about that. Right. I'm not saying that. The system believes you're 18, and what does that allow you to do? Let's hear from the young folks here. What's that mean when you turn 18?
Your own appointments.
You can make your own appointments. What else?
Call in prescriptions.
You can call in prescriptions. You can do that before you're 18 if you'd like. But what is the big thing that happens when you're 18? Anybody? Anybody know? What about privacy? Let's talk about what privacy means. Oh, somebody's saying yes. So do you want to? Okay, wait a minute. I'm afraid you got to be Oprah here.
Well, I was talking about when you turn 18, you have complete control of all of your medical past in terms of confidentiality and who you're willing to share it with. And I actually had to ask to allow my parents to see it because you have to be really careful with that because when you're 18, you lose or you gain all that independence and all that privacy.
Wow, so that's a big opportunity and a big thing that you have to think about. That's really hard for parents. Is anybody in college here? Yes, we've got. So what happens to your grades? Do they go home?
No.
Yeah. And how do your family feel about that?
Yeah,
right. Right, so this is the beginning of the information going directly to the young person, and they can choose to share it or not, right? And I think that's a big step for families, for everybody. It's a little bit of a shock. I think you're talking about that. It was a little bit like, whoa, I paid the bills. That's from the point of view of the parent. I've got kids that went off to, post high school, and wait a minute, I'm paying the bills. Why can't I get the grades? Right? But equally, you are paying the bills now, which is good in the sense that they can stay on your insurance if you have it. But that's something that the young person has to think about. Everything that they do, even though they have to give consent, that information actually does go back to parents. And I'm always reminding people about that because there are things that young adults maybe want to keep to themselves, right, that you don't necessarily want to share. I always ask the question, how would parents feel that suddenly their information was shared? Most parents go, oh, I don't think so, right? And so it's okay for some young adults to feel the same way. All right, so that's a big step here, all right? And does anybody have a transition plan in the audience? Have really sort of worked through it. Wow, so that's why you're here today? That's great. We can talk about that, what that means, right? So let's list what you or your child should know, all right? So we're talking about down to the littlest detail here. I know some of you put some things down, but you really have to think through what you do as a parent to help the person interface with the system that they're going to have to learn. So you're getting a sense here, there's a lot of steps here. It needs to start slowly. Nobody can pick it up all at once. I think the hardest thing is if it suddenly starts at 18 when everything is suddenly not the same. So it's good to start earlier if you can. You've heard this mother talking about a 10-year-old ready. A lot of people are ready very early to take on some of this, right? And they do take on some things. But like all people, we're sort of want somebody to take care of us, but not really, right? Only the amount of what you feel like you want that day, right? But in the end, we all got to do it all. It's just a question of how much you want to do. So I'm going to finish up here, and we'll bring up a lot of these things. There are a lot of things we didn't talk about here that we need to talk about. We'll come up with the panel. We've got some great physicians here to talk about today. So I'm going to run through a little bit some other things. So when we talk about healthcare transition, we're talking about something that's a process. So that's what I was talking about. It can't be done in 2 years. It probably takes anybody in a major transition. How long? A long time, right? How long did you anticipate that you would leave home to go to college? A long time. It's sort of everybody thought it was an expectation that something was going to happen after high school, right? So it takes a long time. So you want it to be one that's a process over time, right? And there, the components of it, self-determination. She was talking about that. What do I want in relationship to my cultural values? What I want to do with my life around this illness? Planning around what I want, preparing for adult health care, work and independence, inclusion, and including your life, right? This is your social life. What do you want to do outside all the school that you got to do, and your nagging parents and your nagging professionals that are after you to do all things, and so you want to start early. So it is a process, right? So I encourage anybody here who has the opportunity to start very early. So the data is pretty clear that if you don't capture somebody on this around the ages of 12, 13, and 14, it gets harder and harder and harder to think about. Young people are thinking about their health care less and less and less until they get to be what age? When do you get sort of executive functioning? I know none of us feel like adults, but when do you think that is? What age?
30.
So he thinks 30. Okay. Anybody else? Well, you're pretty close. So it's around 25 or 26 average that people really understand if and then. Now that's a little bit of a shock for people, right? If you don't do your medicines, if you don't go to the doctor, if you don't do A, B, and C, then this is going to happen that people really get, right? It's very hard. And it's because of what's happened by the time you're 25. You've gone through a lot of mistakes, right? And you begin to learn a tough lesson, right? If I look at my cell phone and drive, and you know how many people do that until they have an accident? A lot of people don't stop doing that, right? So that's the problem. There has to be some kind of thing that people get used to thinking about here. So let's think about, you're not alone. So there are 18 million of you guys out there. About a quarter of you have chronic conditions. Most have not thought about this, right? We just talked to your family here. They hadn't thought about it. They sort of disappeared and showed up in the system. So you're having to do something that nobody else does, but you're not alone in that there are quite a few now that are being asked to do this, right? The Accountable Care Act is out there and really asking young adults to be connected to the system. But it turns out they're not, right? Young adults between 18 and 25 visit the emergency room more than any other age group under the age of 75 in this country. We're talking about healthy people. They use the emergency room as their physician. That is not a good thing to do. There's no continuity of care there. Now, of course, young people drive cars and have accidents. They do all the things that all of us do. So they're in the ERs for good reasons, but a lot of times they're there because, as my son once did in front of me, he said, you know, I got a sore throat. I got to go to the doctor. He got on his cell phone and said, the emergency room up, across town has the shortest waiting time because they're all published. And he went there. And I was totally appalled, right? I said, really? That's how you handle your health? So, people do this, and we need to get them to think differently, all right? And there are lots of surveys of your providers. So now we've been talking about you. Now let's talk about your doctor a little bit, right? This is hard. This is hard. You'll hear this. This is as hard for them as it is for you. I know that's sort of hard to think about, but it is. It's really hard for them too. All right. So what do we know if it isn't systematic? We know this over and over again, right? Your health doesn't do as well. We see some of the worst problems in health occurring between this gap years. If we had people prevent things, we wouldn't be in so much trouble. We're talking about the general health, not just folks that are sitting here in this room, right? Quality discontinuity of care is a big problem, and young adults and families really are dissatisfied. A lot of them are frustrated that suddenly they're dumped out of a system and suddenly have to find their way in the next system, and they find that difficult along the way, all right? And we have a big problem of medical errors in this country. And what is that about? Why do we have medical errors? A lot of it's about communication, right? We didn't know, we didn't take it down, people didn't tell us, and communicating amongst ourselves, and we know the costs are increased. Everybody's about cost, right? We don't want to we want to spend the money where we need to, right? All right. So I'm going to ask you a question, another question here. I got 22 young adults up here that have been successful, and however you want to define it, right? They're handling their own health care, they're married, I don't know what it is, right? And what did they say was the most important factor to making them be successful? All right. So I'm going to give you a deal here. The deal is, here's the list, the top 5. What was the most important one? Family and peer support. Looks like that's going to take the house down here. Okay, and then parental support or without overprotectiveness. Oh, we got 1 or 2 they're saying that. Okay. So these are all important, right? There's no doubt that all these are important. But the one when you talk to young adults is this one. Oh, my children get so upset when I talk about this, right? And why is that? So let's sort of think through this. When you get young people with significant chronic illnesses and disabilities, I'll say, you know, there was one person who sort of treated me like everybody else, right? I could carry the water on the team even if I couldn't play. It was my minister. It was my parents. You know, it is some of his parents, but I was treated like everybody else. So this is a study that was done over now 35 years of following a group of people from the island of Kauai. You'll say, well, that's not my life. But they moved all over the United States. And this is sociologists who followed them. And without a doubt, this happens at home first. So that's what the chores are about. And when we do studies of young people with chronic illnesses and disabilities, it's the first thing that goes. Oh, Johnny doesn't need to do it because he's got to do his physical therapy. Oh, no, he goes to the hospital so much he doesn't have to make his bed, right? And two things happen when you're let out of something that everybody else does, right? In a young person, the first thing they think of is, I am so sick, they think I'm going to die, and I don't need to learn that, right? That's a pretty scary thing, and that usually shuts people down. Or, I am so important, I don't have to do what everybody else does. And how do you think that flies in the workplace? Very poorly, right? So I just leave that with you. It's one of the first questions I asked. There are cultural differences about doing chores in the household, but if it's something everybody else does, it's something your young person needs to do, whatever it is, all right? All right, and we know that these people that are here, congratulations, you're here, but I'm sure this isn't the most important thing in your life at the moment, right? You'd really like to make some money, get out from underneath your wonderful parents, right? And be with your friends. I mean, the fact that they're here Saturday morning is most impressive here, right? So we have to remember as adults that that's where their heads are. They're not where your head is at all, right? You've heard this, right? He's not interested in filling out a form. He doesn't need to. What's the deal here, right? So you got to tie it to something that's important to them, right? Right? He's going to have to fill out a job application sometime, right? There are a lot of things that is going to be important to him, and you got to tie every little inch to that, right? All right. So their priorities are lots of people have done these studies here of young people all over the world, and they pretty much come out this way, right? Making money, a good job, independent living skills. So healthcare is pretty low on this list, right? Legal rights, and only in the U.S. is it protecting yourself from crime, right? Sad but true. And obtaining financing for school, that's a U.S. issue as well from other developed countries. Okay, let's quickly talk about the differences between the two systems here that we began to talk about around age 18. This is a very crucial thing. The cultures are very different between the pediatric and adult system by the nature of exactly what we talked about. That wonderful age 18 and that law that says you have a right to keep your information to yourself, right? And that is a big difference. And sometimes pediatric systems forget about that and continue to sort of go as you have been, even though you're 22 or 21. And then you walk into an adult healthcare delivery system, and the first thing they're doing is saying, you're going to sign this form for your family to be in the room? That's a little bit of a shock. It's also hard for them to do because they're just meeting you, right? So let's sort of think about it. So in pediatrics, in general, it's all about letting growth and development. You're going to get older, you're going to get bigger, you're going to do more things. I hate to say this to the adults in the room. It's all about me as an internist and trying to keep you as fit and as good as you are right now. Because the overall picture is you're not going to be as good in the next 10 years as you are right now, right? That's a very different mindset, right? Very different mindset, right? The focus in pediatrics is on the family. Now, the focus in internal medicine could be on the family too, but you have to let somebody comes in. If a husband comes in, then you end up having to get them to sign that it's okay, right? So that's very different. And, you know, in pediatrics, they're all about you and being sure you get something done, just like your mother or your father, right? They always want to do that. I cannot, as an internist, do that, right? If somebody doesn't do it, there are legal systems in the pediatric system. I can go get a court order and make you do as a parent what you're supposed to do. Can you imagine if I went and called the police and said to the parents, you didn't take your hypertension medicine? Police comes and says, take it. There's just no recourse here on the adult side. So that's why advocacy and learning how to do things is extremely important. I have no ability to make you do anything. All I can do is say, I think you ought to do this. And then you go out and do it whether you're going to or not. And I'm sure parents, you've not done things that your doctor said you should do or somebody told you should do. You just made a choice not to, right? Insurance services, as you know, you have to qualify as you get older. You just don't get to do it. And non-adherence, I can't make people do what they want to do on the adult. I want them to do, right? Procedural pain's a big issue on the adult side. Addiction is a big issue, right? So you have to deal with it differently, and you have to discuss this at length. And the other thing is, adults don't go to the doctor unless they're sick. So every adult that April, you're going to hear about, takes care of, and I take care of, is an adult with a special health care need, right? And in kids, the majority of what pediatricians take care of is healthy kids. And your child is very special because they're different, right? And as an adult, you're not that much different. All right, so there are issues for providers. We can talk about that a little bit later. So where do you start here? Oh my gosh. So you want to prepare youth. These are the obvious things we've talked about. Become more informed, take charge. You've heard these words already. Handle more choices with less direction. That, you heard that from some of the parents here as well. Become their own advocate. So you've got a lot of these on the list here. Now, what's a healthcare supervisor? We'll talk about that and find and use resources. So this is the changing role you're all headed for, right? Anybody want to tell me what a consultant is? So a consultant does something when they are asked, right? You decide to get somebody to contract your house, you decide whatever. So notice what happens here to the family. You become a consultant. And my kids bring this up all the time. They're in their 20s. I start talking to them, and they say, I didn't ask that question when I'm beginning to sort of go on about something, right? I didn't ask that question, so please don't give me that answer, right? So you can see what happens with time. The young person finally supervises. They can't be the consultant, right? Because they're the person with the illness. And you can see that the provider becomes a consultant pretty early on in it. When you're turned to 18, I can only make lots of suggestions, but I can't make you do it. So I'm going to whip through these. I'm not going to get through all these quickly and talk about this clinical report that's out there so you as family knows what's available for providers. So in 2011, the big systems, we're talking about the College of Physicians, which is all internists, family medicine, all the family medicine docs and the American Academy of Pediatrics sat down and said, we know this is a problem. And they set out this line, as you can see here, age 12, you should start this. You should be transitioning out around 18 to 22. So that's the general guidelines out there. That's what we're headed for. We call this the clinical report. And then we had to go ahead and actually figure out what to do here. So there became steps and tools. They're all on gottransition.org. I'll show you some of this quickly. And you want to know, in all of your multiple doctors you're seeing, what's the plan, right? You don't want to be taken by surprise here. When am I expected to leave this practice and go to another one, right? That's an important question. It's a little scary question because it's hard for providers too. They don't want to necessarily let you go either. And planning, do you have the readiness skills? We'll hand out a list. And then a transfer checklist. These are all things that are available to you if you want. And this is the website. I recommend if you want to go there. There are 3 different, well, there is a page for providers, a page for young adults, and it's young adults answering questions, and there's also resources there. And this is the general elements of transition you can see here. Around 12 to 14, you're talking about what this plan is going to be. Then you're beginning in 14, 15 to 18 or so. You're talking about assessing your skills. And then you're talking about the kind of doctors you need to see, collecting the documents that you need, and then going on to completion here. There are lots of tools. You can see them all here. If you get up on the website, you can find them all. And this is about a transition policy. And I'm talking about when you go to the adult practice, what's their policy, right? You want to know, can you be in the room or not? You know you shouldn't be, but you'll find out, right? And then is there an orientation? You want to know about the adult practice. What are the hours? How can my young person talk to them? Can you text your adult physician? Right? How do they communicate with you? Right? You want to know these things, right? And then when you're finished, there's a way to give feedback, which is up there on the site as well. So we're finishing up here. I'm just going to say, what could you do now? Make sure your young person, if they're not handling their household chore, do it, right? And make it worth their while, right? They can't do something if they don't do it. Make a list of questions, concerns they have about their health, right? You heard it from somebody. It's really important. Before you get into your appointment, I would love every adult that I see to do that. Wouldn't that be great, April? And then make a plan, how they're going to take charge to the littlest degree. Take one step at a time. Think about all you do. Have them start, right? Make sure they make appointments. How many of you have, in case of emergency, in your phones? You get these apps, and then no matter what, right? You're on the street. What does an emergency person look for? They're not going to look for your wallet. They're not going to look for your purse. They'll look for your phone. It happens to be in your purse, fine. But that's the first thing they're going to find, and that's the one thing you want. Every adult and every person in this room should have this available. Just choose who that person's going to be when they call, and they should know all about you. Because, boy, does the emergency service want to know about you, right? Because you've got some issues and you want to be handled appropriately. So that's really important, right? And I think this is it. And what about a medical summary? Does everybody have one at home? So everybody should have a medical summary. It could be a paragraph. It doesn't matter. It's what's about. You know, you could have the doctors on the list if you want, but it's your allergies, your medicines should be on your computers. And if you have to go somewhere, you press print, and then you don't have to answer all those dumb questions the doctors keep asking you, right? It's very important. Adults should have it too, right? Your last EKG, if you have somebody with heart disease or whatever. Very, very important. All right. So thanks a lot. I think I'm right on time. I really appreciate us thinking about this together. I hope it was helpful to get you to be in, but you've got a great group of consultants here. You have to stand up and ask them at the break to find out how they did it, right? You've got somebody you can talk to right over there that's going to help you figure out how to do this, right? Thank you very much.
Thank you, Dr. White.